We're going to switch gears here. A small Detroit hospital is halting admissions due to an outbreak of a rare drug-resistant fungal infection known to spread in healthcare facilities.
It's called Candida auris, and so far the state health department has confirmed 7 cases in the last 5 weeks at Select Specialty Hospital in Northwest Detroit. The hospital is located within Sinai Grace, which says the outbreak has not spread to other areas of the building.
7 Action News reporter Brett Cast spoke to a spokesperson from Select Medical and a doctor about this rare yeast strain and its prevalence here in Metro Detroit.
On the 7th floor of Sinai Grace Hospital is Select Specialty Hospital, a separate 35-bed hospital not affiliated with Sinai Grace or DMC that takes care of seriously ill patients.
We take care of prolonged ICU patients that are complicated, patients that are seriously ill.
Samuel Hammerman is the chief medical officer for Select Medical and says recently at least 7 patients in their Detroit hospital have been infected with Candida auris, a yeast that's resistant to many drugs and can cause serious illness or even death.
None of the patients have suffered with any significant consequence of disease. This is not an invasive disease, a serious disease in these patients that we have found.
But the outbreak has led the hospital to pause all admissions. The yeast first reached the U.S. within the last decade and over the years has been found in more and more states, mainly spreading in healthcare settings.
Back in 2019, the CDC named it one of the urgent threats because of how resistant it can be, because of how dangerous it can be in the people who are really susceptible to it.
Dr. Matthew Sims with Beaumont Health says those susceptible to the yeast are usually sick patients with weaker immune systems, and it spreads by contact.
This isn't like COVID that's going to spread by just meeting people. It doesn't spread easily among the healthy. And it doesn't cause a lot of disease among the healthy.
In the meantime, the hospital and MDHHS are working to identify the source of the outbreak, while also working to contain it and bring it to an end.
We'll continue to work closely with them throughout this course, certainly being cautious and prudent along the way.
In Detroit, Brett Cast, 7 Action News.
All right,
Moving on from COVID-19 and monkeypox, there's now a new virus known as tomato fever or tomato flu, which is raising concerns across the country. The infection, which actually has nothing to do with tomatoes at all, is a rare viral disease that causes red-colored rashes on the body, and hence the name. It also causes skin irritation and dehydration. Tomato fever is also known as the hand, foot, and mouth disease. Some other symptoms of it include fever, body ache, a change in the color of one's hands and legs, fatigue, nausea, and blisters. In a majority of cases, young children are affected by this virus. While the illness is not fatal, it is very contagious. The causes of tomato fever are still unknown, and scientists have still not figured out which specific family of virus is causing this. Cases of tomato flu were initially reported from Kerala with about 80 cases. Cases have also been reported from border districts of Karnataka and Tamil Nadu. In Odisha as well, more than 24 children have been diagnosed with tomato fever. No deaths have been reported due to the virus yet. For The Print, this is Gauri
New York
Nara.
say the virus that causes polio has been detected in New York City's wastewater. This comes weeks after a case of polio was identified in New York. Health officials say that case occurred in a previously healthy young adult who was unvaccinated and developed paralysis in their legs. Now, with detection in the water, officials say this could mean it is circulating locally.
As if we don't already have enough to worry about with monkeypox, COVID, and polio, there's now cases of West Nile virus being reported here in New York City.
One man from Long Island was infected with it this last fall, and he is sending a message out about just how brutal the experience was. Jody Goldberg has this story.
At first, Bill Fastenau thought it was a case of COVID-19. It was September 2021 when the 60-year-old started to feel sick.
I pretty much isolated myself in the basement.
But when symptoms didn't subside,
Very bad headaches, neck pain, really unable to get out of bed.
Bill ended up in the hospital, never thinking what he had was West Nile virus.
I did have an experience with a bunch of mosquitoes, despite the fact I had long sleeves, DEET, a hat, all that stuff. What concerned me the most was really nobody knew.
No one knew until the Department of Health health call days after he got home. Through hospital blood work, they ultimately determined it was West Nile.
I really wasn't better until the end of March of this year.
The electronics technician by trade was prescribed a high dose of steroids and was out of work for 6 weeks. When he did return, his memory was still off.
There were a lot of things I did every day that I was kind of like, hey man, how do I do this again?
According to health experts, mosquitoes infected with West Nile virus are typically present from July through October, with peak activity during the months of August and September.
West Nile virus can be very serious and very devastating. The only good news is that that doesn't happen very often.
Dr. Bruce Hirsch specializes in infectious disease. While 75% of people bitten by mosquitoes with West Nile have little to no issues, he said the virus can be fatal for about 10% of people with severe cases, and seniors are most at risk.
Avoiding standing water, fixing your screens, avoiding exposure to mosquitoes is particularly important.
As for Bill, who normally keeps to himself, he's speaking out to make people more aware so they don't wait as long as he did to see a doctor.
I won't get it again. Obviously, my family can.
The New York City Health Department has 2 cases of West Nile virus on record so far this year. There are 3 confirmed in Nassau, no reported cases in Suffolk County to date. Jody Goldberg, Fox 5 News.
22 million people in 9 states are on alert over what the CDC is calling a fast-moving E. coli outbreak. And right now, little is known about what's causing it. Nick is back now with what you need to know. Nick?
Yeah, Adrian, so far about 30 people have gotten sick. However, officials with the CDC say that number is likely to rise. Nearly 100 other possible cases are being investigated. The biggest concern right now, we don't know the cause of the current outbreak. The cases confirmed so far are in Michigan and Ohio. Health investigators say the bacteria tested in those currently sick suggests they all got sick from the same source. E. coli is typically transmitted through contaminated foods. In the past, we've seen beef recalled. Lettuce is also frequently pulled off of the shelves. Here are the basics. Keep clean. That means hands, utensils, and counters. Rinse fruits and vegetables before eating or cutting. Raw meat, poultry, and seafood need to stay separated. When you cook a used item, use a food thermometer. That means that meats have to be a certain temperature in order to kill the germs. And get those perishable foods in the refrigerator. Now, symptoms of E. coli develop in 3 to 4 days from exposure. Fever, stomach cramps, dehydration, all signs of illness. Your best line of defense, get to a doctor. Health officials say it's hard to track total exposure numbers, and that's because many don't seek medical care and are not tested for E. coli. Adrian, I think a lot of people are just rushing and not always taking the necessary precautions. Slow down, wash your hands, wash your foods, cook them properly.
A deadly neurological disease in deer is spreading in North Carolina just weeks before hunting season. Wildlife officials say they found a second case of chronic wasting disease in a deer in Yadkin County. The deer was just a mile from where they found the first case. To minimize the spread, wildlife officials say you should transport any deer from outside that area seen on this map here. This is just west of Winston-Salem. So far, there have been no reports of the disease spreading to humans.